My name is Stephen Walkowski, and we're here in the OMM lab in Ohio University Heritage College of Osteopathic Medicine. This is where first-year medical students learn the skill and art of osteopathic manipulative medicine, or OMT. I'm here today to talk to you a little bit about the philosophy of OMT and the practice of OMT in an effort that you will feel more comfortable with your students or your trainees' abilities and encourage them to incorporate OMT into their practice on a daily basis. First, a little bit about the philosophy. Osteopathy was started by our founder, A.T. Still, in June 22nd, 1874, when he flung the banner of osteopathy to the wind. It's important to know that he was an MD of the day, and he practiced according to the medicine of that day. He witnessed, unfortunately, the death of 3 of his family members to meningitis, and reportedly that sent him into a depression, and upon reflection he came out of that recognizing the need to improve the present practice of medicine. Osteopathy has 4 major tenets or philosophical principles. First, the body is a unit. In this day of subspecialization and fragmentation of the human organism, we believe, from an osteopathic principles perspective, of the unity of that organism. Not only that, but also the incorporation of the human person into his or her entirety of environment. Next, that structure and function are interrelated. We look at the musculoskeletal system not only as a mover of the body, but also in its relationship to the rest of the organs, both from a nervous and a vascular perspective. That the structure of the body, or potentially impairments of that musculoskeletal system, may impact the function of the internal organs, in addition to local pain problems. Next, the body has the inherent ability to heal itself. We know this from our study of immunology and its relationship to endocrinology and neurology, that even a person's thought or mood can have an impact on their immune system. We know that the body has an amazing ability to maintain a homeostatic temperature within a few tenths of a degree, and do that in a variety of environments. The last tenet being that the treatment of disease must take into account the 3 previous tenets is just a reminder that in any situation in medicine, we must take into account the risk-benefit ratio of any treatment. In that, osteopathic medicine, or osteopathic manipulative medicine, has an extremely low morbidity, but has the great ability to assist the body in its natural ability for self-healing. I'd like to talk a little bit now about the science of OMT. In recent years, there's been an increasing body of literature surrounding not only the mechanism of OMT and the scientific basis behind that, but also its applicability clinically in a wide variety of specialties, from family practice to internal medicine, obstetrics, neurology, cardiothoracic surgery, length of stay, and patient satisfaction. Together, these provide an increasingly important body of evidence to suggest the utility of OMT applied to our daily outpatient care as well as inpatients. Osteopathic medical students have been taught from the first day how to apply OMT safely and conscientiously. They've been versed in a variety of techniques, most of which are extremely gentle and easy on the patient. Those include strain counterstrain, where the physician finds a position of comfort for the patient and allows the tissue to release around any restriction. Functional methods, in which the physician finds a position of ease in the tissue and allows for release during the treatment. And muscle energy, where the physician brings the patient's voluntary muscular contraction to improve motion and function. These are all easily applied, are safe for the patient, and provide little to no discomfort. They're usable in the hospital setting as well as the outpatient office. In addition, the students have been given an OMM quick card to allow them ready reference in approaching any case from an osteopathic standpoint. This allows them to think about the case considerations around any medical case, including the sympathetic nervous system component, the parasympathetic nervous system component, the fluids or lymphatic system component, a biomechanical component, and the pain component. By addressing all of these issues, it's very likely that any problem can be addressed osteopathically. Finally, I'd like to talk a little about precepting osteopathic medical students. My assumption is that you have little or no experience with OMT, or perhaps you haven't practiced much OMT since your days in medical school. Precepting students is easy. Two main questions can guide you through all of your precepting experience. Simply by asking, after the student is done with the physical exam, what did you find on your structural exam? This indicates that you value the structural exam and its components that may lead to an osteopathic treatment. The second question, what are you going to do about it? This gives a student an opportunity to describe for you the types of treatments that they would use in any particular condition. The students will find it much easier if you ask these questions in cases that are exclusively or almost exclusively musculoskeletal. Low back pain, for instance, mid back pain, headaches, neck pain, shoulder pain. What did you find on your structural exam, and what are you going to do about it? These should be easy questions for students at this level. But in the spirit of challenging students to go even farther with their ability, increasing the complexity of these questions is important. So in cases like colds, pneumonia, irritable bowel syndrome, urinary incontinence, what did you find on your structural exam, and what are you going to do about it? This will help spur the student on to think, how might OMT be helpful in each of these situations? They have learned the principles of application of OMT to these cases. What did you find on your structural exam, and what are you going to do about it? These two questions will guide you through years of precepting from this point forward. And thank you finally for precepting our students. That process is immensely important to growing our medical students from book learning and knowledge to wisdom and treatment in osteopathic care.